Hola a todos, I'm Gabriela Watson-Burkett, and this is episode 5 of Diálogos.
No lo puedo creer. ¿Qué tal? I'm Vicky Diaz-Camacho. Let's start today's show with what's on our radar.
The students in K through 12 here in the city now face another problem: lack of support for more certified librarians.
Yeah.
Vicky, you have all the information about this.
Which, of course, we'll credit to the Philadelphia Inquirer, which I read. But what's essentially happened is that a grant that was dedicated to expanding, reviving, and reopening school libraries has been cut. So among 215 schools in the Philadelphia School District, only 3 schools have full-time librarians. That's wild to me. And 2 others have librarians, but they are also teaching. So we already know educators are extremely stretched thin, and there's a big need for librarians in our Philly schools.
Absolutely. It's so heartbreaking to see that schools don't have libraries or librarians to help them. Tell me, did you like going to libraries growing up?
Oh yeah, that I would even say it was among my most safest spaces that I would go to. What about you?
Yes, I did like it.
Yeah.
And I like just reading.
Yep.
You know, that the magic, reading a book from beginning to start, it was really great.
Yeah.
It was grounding.
It is grounding, and you learn so much, and you get to go to different worlds too through storytelling, right?
Absolutely.
So these kids deserve that too.
They do. More people will have access to public Wi-Fi. Vicky.
Yes, that's awesome. Like across 180 different sites in the city, which is pretty cool. Libraries, recreation centers, and the city actually provides a list of all of these sites on phila.gov/Wi-Fi. So if you need to access it, just go there and find it on the map.
Up next, we'll learn about culturally affirming therapy and healing.
This March, the World Health Organization raised concerns about the dire need for more mental health services across the nation, underscoring how this area has long been underfunded. The organization called for changes in health policies to fix those deficits and to better meet international human rights standards. And research shows that Latina women in particular are at an increased risk for anxiety and depression, double the rates when compared with Latino men, and are less likely to seek help. The barriers run the gamut, but costs and difficulty finding a provider for people of color and trust are 2 key concerns. In the studio with us today are 2 trauma experts whose focus is on culturally affirming mental health care.
One of our guests is TaLisa Ramos. She is a first-generation Latina and Indigenous Taino college graduate. She's a trauma and decolonization educator, a death doula, and founder of the Ancestral Healing Collective. Welcome, TaLisa.
Thank you.
Our other guest is Nicola Pierre Smith, a licensed professional counselor and the founder of Melanated Women's Health. She is also the group's clinical director. Thank you so much for being here with us.
Thank you for having me.
Yeah. So first, what are both of your definitions of culturally affirming care?
So for me, and I think most people that go to grad school, we learn therapy, all the theories, the approaches from a white clinical lens, in that there is no consideration or any research that's done extensively on the Black and Brown community. So we're learning something that doesn't all the time or doesn't necessarily address some of the nuances with our lived experiences. So for me, what culturally affirming therapy means is that anyone that's providing mental health care, they're having some cultural humility to know that even if they're from the same culture, they may not have the same lived experiences. And it's important for them to essentially approach everyone with some curiosity and some compassion.
Thank you.
That was beautiful. And I'll just amplify that in regards to, in colleges and higher education systems, when we're talking about counseling and therapy, we are working off a westernized model framework, a Eurocentric framework that sometimes doesn't honor the distinct and diversity that's within Black and Brown cultures, right? And so having this culturally responsive or this culturally affirming approach to therapy, to healing services, it's so essential when we're meeting the client where they're at. And infusing their culture within it as well, and allowing that space for their culture to breathe and to be a part of it.
Thank you so much.
I was going to add, it's great that you said that, because when we do learn things that may be more like Eastern medicine, like mindfulness, meditation, it's also whitewashed. In that we usually in grad school, we're not getting the history of where it's coming from, because it's more colonized in the practice by the time it gets here, and then it trickles into our curriculums.
So we know it's a long journey. We want to know, like, what brought you guys to starting your own businesses?
So I grew up first generation, was born and raised in Reading, Pennsylvania, so not too far from the Philadelphia area. My family is from Puerto Rico, both my mom and my father. So my mom did not have the chance to go to college. She didn't have the chance to graduate high school because I came a little early, y'all. I surprised her a little bit. So I came a little early, but that was the one vision that she had for me. Like, I had no idea that there was any other life other than college after high school, right? Because she was like, you're going to college. This is the next step. This is what you got to do. And I remember her telling everybody on the block, in the bodega, right? Like calling family from Puerto Rico and saying, oh, my baby, she's going to college. She's going to be a doctor. Because why else would you go, right? Right? Like, we're from the Caribbean. You're either going to be a doctor, an engineer, or so, or a business person, right? Yeah. So I'm like, okay, that sounds good. Let's choose that major. Pre-med. I learned about 5 minutes into my Bio 101 class, my first year, that I was not meant to be a doctor. I ended up actually failing out of college at that point, and went back home, and I struggled. And while I was home, I think that was the opportunity for me to really assess, like, my life. Growing up in poverty, growing up in a single parent household, my mom sacrificed everything to give me that moment to be in college. And in that space, I said, I need to go back. I need to go back. I know, all right, I won't be a surgeon, but I know that there's some type of healing. I want to make sure that I'm helping people. And my college gave me a second chance, and they were like, all right, we'll give you a second chance, but you can come back, but you have to see one of our therapists and counselors at least biweekly. And I'm like, therapists or counselors? What is this? And I remember sharing it with my family, and they're like, we don't do therapy. We don't do counseling, right? Like,
depression doesn't exist in Latino culture.
You need to pray it away. Like, you just, and so at that point I was like, what do I have to lose? If this is what it takes for me to get into that space, I'm going to do it. And so then I started to go to a counselor, and she really started to help me explore and navigate some of the feelings that I felt like I was repressing. Some of the things that I saw continuing within my family when it came to mental health, when it came to approaching anything of the sort surrounding mental and emotional wellness. And so from there, I got really, really into my equity and inclusion work, especially because I was going to a predominantly white institution. And I knew that we deserved more. We deserved scholarships. We deserved a cultural center on campus. We deserved educators that look like us, staff that look like us in those spaces, especially if you're recruiting us and you're having us come here. So that's when my love for equity and inclusion really came forth. And I just fell into this idea of the social work major, and I loved the work that we were doing. I loved having a name to it, and being able to go into spaces and help community members, and how diverse it was. And from there, I went into the mental health field. I did emergency room social work, inpatient psych, and then that went into higher education, where I was able to really utilize that space to help first-generation college students, students within the LGBTQ plus community, and students who were first-generation, and assisting them and supporting them through navigating the college, right? And I got a call from the governor's office. It was the Office of Advocacy and Reform, and their biggest point was, forming a trauma-informed Pennsylvania. And so they were all in to the idea of, we need to understand the populations that are here. We need to understand the equity issues that are within Pennsylvania. And I went through the process. They hired me, and it went off from there. But I wanted to go back into the community, and I felt so drawn to it. And I think that's really where the Ancestral Healing Collective was birthed. Like this idea of me having this understanding and walking in spaces where I was the only Latina in the room, the only person who maybe was even homeless at one point, the only person who experienced poverty. And I was allowing my voice to be heard. And I'm like, what if other people in our community felt that empowerment, that they could also share their stories and we could band together? And so that's really where the Ancestral Healing Collective was birthed.
That's powerful.
Yeah.
That's powerful. And Nicola, now it's your turn.
I'm Jamaican. I came here for grad school. I had already had a psychology degree, and in Jamaica, like in most island countries, mental health does not exist, though we know that's a myth. There are a lot of mental health conditions there, and locally, we have one major hospital for a population of 2.8 million for mental health. So we only have one mental health hospital for a population of 2.8 million, which means there is very low access to services. So I was always curious about how the mind works. I wasn't necessarily interested in business, though I'm pretty sure that's what my family preferred, because still there's some underappreciation for the work that I do. And it's more like, are you sure you don't want to go back to school to do something else? Are you sure?
Doctors, engineers,
Lawyer.
lawyer.
Yeah. So when I came here for grad school, I was the only Black person in the cohort. I was also the only immigrant. And it was difficult in a lot of ways, like things around accent, or I had a huge culture shock as well that happened. And for me, I did my thesis on psychological help seeking between Americans and Jamaicans. And the data shocked me in that it wasn't what I was expecting. I expected to see, like, oh, here are all these Americans who want to pursue mental health therapy, and I'll find the reason outside of stigma for why Jamaicans aren't. And the data revealed that there are very similar patterns across the two countries. And what it came down to was it wasn't geographical location, it was really race. But even to your introduction earlier, it at that time in 2012 is mimicking what we're seeing today, is that the Black and brown community were seeking mental health services less than non-melanated folks. And it came down to things like stigma, no representation, cost, misunderstanding of what symptoms are and what they look like it's depression and not laziness. But my work experience was really difficult in that, again, the critique, microaggressions, and just some really tough experiences. And I realized it got more difficult the higher I progressed.
Of course.
In my career.
Yes.
That it was, again, more isolation, less Black or person of color populations, less support. There was an expectation that I can handle without support the challenges that were coming up. So from there, I had an experience attending a workshop where I remember the speaker, as well as others in the room, they had no information on where to get services. And I raised my hand and said, I'm a therapist. Here are all the places you can find a therapist. But at the time, I think I had a lack of appreciation, because as a therapist, you're like, oh, you know where to find a therapist, but you don't realize the extent to which the average person struggles to do that. So from there, I started putting information online, just more like educational, in the sense that I'm speaking in a way where anyone would understand it, and not using advanced psychological concepts that's more medicalized. And I realized that people were asking for more of that, again, asking for more resources, and it became to a point where I had nowhere to direct them. And I thought, well, what if I made myself accessible? Created the business, and then from there started hiring therapists who are also reflective of the immigrant population, because that's near and dear to my heart. So there are therapists there who speak different languages, for example, which is important. And then looking at the cost component, that as a small business, we do want to ensure that we're looking out for our livelihood, and just one small business can't solve the ills. But it was also important for me to ensure that I'm still making it accessible. So then going in network with certain insurances, or ensuring that I'm taking funding from other organizations.
Wonderful.
I really loved that both of you have spoken to education spaces, and being that you are therapists with these lenses of culturally affirming care. Can you talk about how that applies in the workspace, and maybe some lessons that you've gleaned?
Actually, yeah. In every single professional space I've been in, I've been one of the few. I've been one of the few Latinas, one of the few Indigenous professionals within my spaces. And so I think, and can I also say, as a clinician of color, as an educator of color, I think there's like multiple things going on at the same time. I think we want to make sure that we're showing up for our clients, for those who we are serving, right? And walking alongside in their journeys, whether it's healing or education and becoming, a more culturally responsive clinician or educator. And we're also having like our own personal experiences and working through microaggressions and bias within policies and the places that we're working with, or the agencies we might be collaborating with. And I think engaging my colleagues in conversations where we do not share the similar identities or the similar backgrounds, but giving and offering perspective when they are working with clients who are of color, who are lower socioeconomic status. So really providing like that cultural responsiveness within supervision, within engagement, because it's not just about who we're serving, but I want to make an impact on our colleagues as well.
You mentioned supervision. I'm not sure how aware you are, but in our field, even after we've graduated from school, we require, like, depending on if it's social work or professional counseling, we require like 2 years of supervision, and it's tremendously expensive.
Oh my God.
So that's the first thing. You have to pay hourly for it, or you're getting into a work environment where they're offering that free of cost in exchange for the labor that you're providing. So at Melanated Women's Health, a change has been made where I'm pursuing younger therapists in terms of helping them to acquire those hours, and that they're not getting charged for that. That's just a part of I would say perk, but not really, because it's something that they do need. And it's within that weekly supervision that we're having these conversations about the intersections of their own identities and how that shows up in the room. Because for me, my 2 years, I had white men as my clinical supervisors, and at no point were there any conversations about how my immigration status may be impacting the work that I do, or gender, and is impacting. So I'm really focused on that clinical space in terms of that's the academic training.
Yeah.
That helping to have young therapists think about what they learned in the classroom, what can they take on from that, and what are pieces that they truly need to reframe.
And it's so great to hear that you guys both are creating space for the new generations to have a lot more resources than what you guys had. I think that's really key for change. Right now, we're going through very troubling times. Right? Our community reach out to us. They are scared. They are in fear, depressed. Can you talk about how was dealing with these situations, some of the approaches you're taking, and any advice that you could give to our community?
Yeah, and a part of that too is like understanding that they're also a therapist who they may have family members who are navigating like the immigration system right now within that too. Or I can think of even international college students who are having to navigate that space. Finals are coming up. They're wondering should they go home or not? What will that look like? So lots of uncertainty and anxiety. And from my position, we know from trauma theories and from trauma informed care that if someone doesn't have some level of predictability, they feel like they've lost control and know there's no safety that exists. So some of the work that we're doing with clients who are in these populations that are, I'd say, I don't want to necessarily say more affected than the general population, but they're at a significant threat right now based on their immigration status. It's focusing on how to return within themselves to find a sense of safety.
Oh, wow. Wow. That's incredible. Did you have anything to add?
Yeah, I will say that on top of that, right, a lot of the work that that I do within like the social work community is really like connecting to resources, connecting to spaces where these individuals can find community in safe spaces, right? With clinicians that they can trust and resources that they can trust at this time. Safety planning has been one of like the biggest things that have been coming across in my service spaces. The idea of, for many clinicians who are within the communities who are being impacted, those who have migrated here, they are also going through these cycles as well, right? These issues that are happening within our community. So one of the biggest things that I always highlight when I'm working with new clinicians or colleagues is like the importance of also taking care of yourself. So I say it all the time, I'm a therapist with a therapist.
So I'd love for you to kind of share some tactics that you often share with maybe some folks that you're supporting. Because right now, obviously, it's a difficult time, but also economically, it's very difficult. So any free advice that you would like to share with the community at large?
For something I'd want to add in terms of that question about finding community and safe spaces is that when you do find those safe spaces is recognizing that you do not need to have all the answers. You do not need to show up perfectly, and you do not need to have it all together in those spaces. So the free advice would really be vulnerability in safe spaces.
Okay.
And what vulnerability really means at the core is being honest that I don't know what tomorrow will bring. I do not know what the future holds. And in this moment, I have the safety of this community that I'm with.
Yeah, and to go off of that, I'm going to say that, like, leaning into that community when you do find that safety, leaning into that community, I think, again, with many of, like, the westernized models or approaches to treatment, it's very individualized, very focused on the individual. But in Black and Brown communities, we heal in community. We heal, we absolutely working through individual, but we heal in community as well. So leaning into the community for support, right? Like that's one of the biggest things that I really stress on. And you know, with westernized models, we talk a lot about medicine, and many times our mindsets go to pills, right? Like being in community is medicine, right? Being with family is medicine. My abuela cooking me a home cooked meal, and me just being able to be with her and speaking in our native tongue and reminiscing on times, like that's medicine, and really making sure that we're finding spaces for that to create wholeness.
Thank you so much for the time. It was been amazing conversation. A lot of folks still are skeptical about pursuing therapy, especially in Black and Brown communities. What would you say for these communities What would you say for individuals who haven't started that journey yet? What are the benefits of having a therapist?
Well, before even getting to the benefits, I would validate the skepticism. Like, that is important. The first therapist that you meet may not be the right therapist. Similarly, like dating or going on a job search, the first pick may not always be the right one. And the skepticism, to some degree, it's somewhat protective in that it's ensuring that you're asking the right questions. You're checking in on what their experience is and working with people that have the experiences that you do. So for the analogy I give is, if I'm struggling with a headache, I'm not going to a podiatrist, even though that person went to med school, because they don't treat the symptoms that I want to work on. So if you're wanting to work on trauma, for example, you want to ensure that you're seeking out a trauma therapist and not a therapist that does not have trauma training.
I think what I would have loved for somebody to tell me right off of what you had mentioned, like ask questions with your therapist. I think that first like initial appointment, I think, I don't know, I had expected to walk in and like walk away from that appointment feeling like ready to move forward in my journey for healing. But it was an intake appointment, and they were asking me so many questions about myself, about my history, about my family. And I wish I would have took a spot to say, can you share with me your experience with providing services to Black and Brown communities, Black and Brown clients? Can you share with me, what are your thoughts about having an anti-oppressive approach to treatment, or how you decolonize your therapy space? How do you continue to, educate yourself on the needs of our community, right? Especially if they're not within the community, and even if they are, like, it's important to ask questions. And so I think my biggest thing is like, be empowered. That's your space, that's your time with your therapist, and ask those important questions. Yeah.
Great.
Can I add one more thing to that? Yeah, and this is even another soapbox that we could go into, but I know we don't have time. In terms of the asking questions and really vetting the provider, we're also existing in a space where artificial intelligence has literally entered the chat.
Yes.
That is the mental health field. And there is a myth that artificial intelligence could replace a therapist. And that is a myth, because even though a chat box can regurgitate answers to you, healing happens in community with people, and that is not a person. And it's also a system that was created by people, which means that it also has built-in biases that exist. So in terms of that question of advice to people seeking therapy, if people are using artificial intelligence because it's so accessible, it's an app that can be downloaded on your phone, it's really remembering that that is not a healing relationship, it is an app.
Such a good point.
Very glad you brought that up. Thank you so much. Well, I think this wraps it up, right? I wish we could talk forever.
Unfortunately. Yes, there is so much more to talk.
There is. But we will be sure to share all of your advice. And thank you so much for your time.
Thank you for having us. This is great.
2, 1. Too often, resources fly under the radar, like this one, the National Mental Health Lifeline, which is 988. Everyone can access it, everyone can call, and you can support a loved one if they're going through a crisis too. And what we've learned is that awareness of the service is extremely low in Black, Latino, and Asian communities. So let's get the word out. Life is difficult. We have resources that can help. So we want to make sure every community member knows that this exists.
Thank you for joining us today. You can check out the episodes on YouTube or Spotify.
And you can follow along on intimedia.org. And if you've enjoyed our last few episodes, please reshare, comment, tell us what you thought, and you can tag us on social media at News by Inti Media. Nos vemos.